Hundreds of patients from across 75 Central Texas counties have received mental health care from a hospital that is old, overcrowded, and lacking proper maintenance. The Texas legislature has identified the Austin State Hospital as one of its top health care priorities. KXAN's Alex Capriello looks at the plans in place to transform the hospital and to provide the help patients expect from it.
A lot of times we suffer in silence.
42-year-old Max Power has battled depression and bipolar disorder all his life.
I was told that we weren't allowed to have problems, only the rich could afford help.
He told me the state hasn't been there to address his most pressing needs.
Texas had allowed its brain health system to deteriorate.
And this map is an example of where people come from into the hospitals in this region.
Dr. Steven Strakowski has been assigned to identify the flaws in Texas's broken mental health care system and to fix it here locally.
A big part of the barriers to that is getting access to care and providing facilities for people where they can get to them easier, more quickly, and that they're modern and provide the best care.
With the help of Senator Kirk Watson, the Texas legislature secured $165 million to completely renovate and redesign the Austin State Hospital. Strakowski concluded the facility was spending upwards of $200 million in patchwork over the years instead of seeking long-term solutions.
It's not possible to deliver the best kind of care.
The reimagined hospital, set to break ground in the fall, will offer state-of-the-art facilities for patients and provide new therapies to better transition people back into their own communities. Power says this new push from the Texas Ledge will allow others like him to come out from the dark.
We don't have to live in fear. We can express ourselves. We don't have to hide it, bury it deep down, and hope that it goes away.
Alex Capriello, KXAN News.
Senator Watson also helped to pass Senate Bill 2111. It lays out a plan to transfer Austin State Hospital operations to the Dell Medical School. The legislature will decide whether to proceed with that during the next session.
Appraisal district records show just how valuable the land is. Since it is government land, it is exempt from taxing. But if it were to go on the market, the current appraised value of both chunks of hospital property is more than $362 million.
And the campus renovation plan there is not sitting well with all of its neighbors. The Friends of Hyde Park Neighborhood Association released a statement today saying the plan does not go far enough. The group is concerned it does not include additional housing, affordable or otherwise, walkable amenities for patients or neighbors, or sufficient on-site parking.